Hi, my name is Becca. Just wanted to make a video for this channel to tell all of you about my story with dealing with Turner syndrome and how I've been dealing with it. I was diagnosed before I was born, so my parents knew the minute I was born that I had Turner syndrome. So that made life a little bit easier as far as getting treatment and stuff, but then we moved when I was about 3 and I started seeing the endocrinologist, and about age 5 I quit growing and got started on the growth hormone shots and was on them for 10 years continuously, and so I reached a height of 5'3", and I'm happy with that. I'm actually a little bit taller than my mom, so that's a good thing. I then started on the hormone replacement therapy. There's been some issues with that. We haven't been able to find a good dose that would work for me, so we've been kind of playing musical medications for a few years now. The one I'm on now seems to be working better, but so yeah. When I was 14, I was diagnosed with osteochondromas in my knees that were believed to be a result or side effect of the growth hormone shots. Osteochondromas are basically a non-cancerous bone tumor, so when I was 16, I had to have surgery, but I was continuously followed up with a surgeon from the time I was diagnosed to surgery. So I had that in 2009. I had my left leg done in that spring, and then the fall of that year I had my right leg done. After my second surgery, I just continued having issues with my right leg. I have a kneecap instability that seemed to have gotten better with physical therapy, and then I started having elbow problems. I have the cubitus valgus issue, so I can't straighten my elbows all the way, but they started locking on me, so it took a while for them to figure out what was going on, but they did an MRI in 2010 and couldn't find anything, but so we stopped going to the doctor for that, because then I started having major issues with my left leg, knee. It turns out that this was 2011. I had to have surgery again on the left leg. I had excessive amount of extra tissue that was basically taking over my knee, causing damage and everything, so that was removed. After that, it didn't really heal completely, but then about 6 months later I partially tore my anterior cruciate ligament in my right knee, so I had to go see a different surgeon to see if I needed reconstruction, and to be precautious, we did schedule surgery, and I did have an arthroscopy, but luckily I didn't have to have reconstruction on that knee. And then finally, in this past summer, I went back to the doctor for elbow issues, right after the conference in California last year, they finally figured out the issue, and it was the same problem I had in my knee on the same side, so I had to have surgery in August this past summer to remove that. It's gotten better, I guess, but I don't think it'll ever be normal. But anyway, and then I went back to my surgeon who did my left knee this past fall for a follow-up, and she noticed that my knee was still swelling up, so she did blood work and another MRI. Turns out that I had a torn ACL in that knee too, and plus I was diagnosed with a connective tissue disease that supposedly caused the ACL tear, so I had to go back and see my other surgeon for that. Excuse me. And I ended up having reconstructive surgery the day after Christmas this past year, so I'm still recovering from that. I can't go back to dance. I can't skate anymore. I can't do much running. I can't. The only thing I can really aggressively do is probably ride the bike. But my risk of injury is too high after this kind of surgery, especially with my connective tissue disease that I've been diagnosed with. But what can you do, I guess? It's a part of dealing with Turner syndrome. Oh, one thing I forgot to mention is that I have severe acid reflux disease as well. I had a bad relapse episode a couple weeks ago to the point where I couldn't breathe and I had to go into the doctor. She increased my meds, and she said that if things don't improve, I have to get an endoscopy, but luckily things have gotten a little better. But I'm debating whether or not to go ahead and do the endoscopy anyway, just to see how much damage is actually done in my esophagus. Yeah, anyway, I'm looking forward to going to Dallas this summer, but I was hoping to be able to be in the town show, but I'm gonna see if I can do a little dancing. I can't really dance, but unless I have to wear my brace, which I do. But we'll talk. I have to talk to my physical therapist about that anyway. But the doctor said not to. I can't dance at all. So I've been in physical therapy since January, and that's been interesting. Oh yeah, also I was gonna tell you about my career choice. I am a freshman in college. I'm 20 years old, and I am going to college to go into the medical field as a surgical tech and hopefully work in the operating room with the orthopedic surgeons. And that's my field of interest. But anyway, yeah. So I'll be moving to Grand Forks, North Dakota this fall, and staying there for 2 years, and I will be training at Mayo Clinic, and then probably working with the Essentia Health System here in northern Minnesota. But anyway, that's pretty much it. Feel free to comment or message me or anything. Find me on Facebook, Rebecca Rose Nygaard. Just type in that and you'll find me if you haven't already. So yeah, that's pretty much it. Just show you this, my necklace. It's awesome. I love it. But anyway, yeah, that's about it. And I will probably post another video here at some point. So, talk to y'all later.